Welcome back to Learning Anatomy with Dr. Bakari. If you are visiting my channel for the first time, you are also highly welcome. In this lecture, we would be looking at the brachial artery. Using this image by the side, this is where we have the brachial artery here, highlighted in red. We'll be looking at how this artery runs, the different branches that it gives, and also some important details that you should know as students of anatomy. The brachial artery is the arterial supply of the upper limb. Even though the brachial artery is limited to the upper arm region, it is seen to further subdivide into the radial and also the ulnar artery. This artery is seen to emerge at the inferior border of the teres major. If we try to use this upper image here, this is where we have the teres major highlighted in black. At the upper border of the teres major, we have the axillary artery, and this is what is highlighted here in green. This axillary artery, just at the inferior border of the teres major, will become transformed into the brachial artery. This brachial artery is then seen to run along the medial border of the arm. If you also see how this artery emerges, you will see that it is around the medial border of the arm, and this is where it is seen to pass through this region. It is seen to specifically pass through the medial bicipital groove. Let's try and highlight where the medial bicipital groove is located. Using this image at this upper end, this region that is highlighted here in red is the medial bicipital groove. This is a topographical landmark that is seen around the medial border of the arm. It is seen to specifically separate the biceps brachii in the anterior region from the triceps brachii in the posterior region. So the intercept between the biceps and the triceps is a topographical indentation where this brachial artery will pass through. It is important that we highlight that the medial bicipital groove should not be confused with the bicipital groove. If you go back to our lecture on the humerus, remember we described the bicipital groove. We say that the bicipital groove can also be referred to as the intertubercular groove, which is an indentation that is seen between the lesser and the greater tubercles of the humerus. This bicipital groove is seen around the humerus, while the medial bicipital groove is a topographical landmark that is seen between the biceps brachii muscle anteriorly and the triceps brachii muscle posteriorly. And this is what is highlighted or harrowed there in blue. So it is important that we are able to distinguish these two structures. Because we have a medial bicipital groove, we should expect to have a lateral bicipital groove, which of course is also a topographical landmark that is seen in the lateral region. And it is seen between the biceps brachii anteriorly and also the triceps brachii posteriorly, but it is located around the lateral region. So you see that after the emergence of the brachial artery, it is seen to then pass through the medial bicipital groove. And after coursing through this groove, it is then seen to be directed anteriorly. So if you try to use this lower image, this is where we have the brachial artery at the point where it is now directed anteriorly. And if you go more inferiorly within the cubital fossa, you will see that the brachial artery is then positioned within it. If you go back to our previous lecture on the cubital fossa, we said that the cubital fossa is a triangular indentation that is created in the anterior region of the elbow. And this is what is carved out at this region. So you see that within this cubital fossa, we have the brachial artery because it has changed its pattern of movement from the medial side to the anterior region. So if you look at the cubital fossa, you see that within it, we also have the brachial artery because of the change in the path of movement. Also within the cubital fossa is where the brachial artery will finally terminate into the radial artery and also the ulnar artery. So if you try to put this image in its correct anatomical position, this is the medial side and this is the lateral side. So you see that the brachial artery will be divided into the laterally placed radial artery and the medially placed ulnar artery. If you look at the bony landmark around the forearm region, you see that at the lateral part, we have the radius, while at the medial region, we have the ulnar. This can also be used to justify how these names are drafted. So around the lateral part is where we have the radial artery, while around the medial side is where we have the ulnar artery. So we now see that the brachial artery, of course, even though it is located or limited within the upper arm region, it is finally seen to terminate around the anterior region of the elbow, where it will finally be dividing into the laterally placed radial artery and the medially placed ulnar artery. These two arteries will also be providing supplies for the forearm and finally divide into branches that will also be providing supply for the hand region. So we say that the brachial artery is the arterial supply of the upper limb. So now let's drive further. We'll be highlighting on the relations of the brachial artery. And this is very important in case we are asked during examination. So this is where we have the brachial artery that is arrowed in dotted red. So proximally, it is related laterally to the median nerve, and medially, it is related to the median cutaneous nerve of the forearm and also the ulnar nerve. But for us to easily understand this, let's try and place this image in its correct anatomical position. This is where we have the medial side, and this is where we have the lateral side. So if you go more superiorly at this upper end, you see that at the lateral side, it is related to the medial nerve. While if you go more medially, you see that it is related to the medial cutaneous nerve that is highlighted here in blue, and also the ulnar nerve that is highlighted here in green. So you see that on both the medial side and the lateral side, it is related to different structures. And this is just in the superior region. If you also drive into the ulnar nerve that is highlighted here in green, you see that towards the lower part, it is directed posteriorly. And this is what is represented here in dotted green. So it is behind the medial epicondyle that the ulnar nerve will pass through, even though superiorly it is seen to be lying medially to the brachial artery. So at the posterior region of the medial epicondyle, we have the ulnar groove. The ulnar groove is what allows for the passage of the ulnar nerve. We've also tried to highlight this in details in a previous lecture on the humerus. If you've not checked up that lecture, please kindly go and do so. In that lecture, we stated that at the posterior region of the medial epicondyle, we have the ulnar groove. This ulnar groove is what creates the accommodation site for the ulnar nerve. And this is what is shown here in this image. So we know that at the proximal part, it is related laterally to the medial nerve. And this is what is highlighted here in yellow. While medially, it is related to both the medial cutaneous nerve of the forearm and also the ulnar nerve. While if you go more inferiorly or distally, you see that the median nerve will be crossing over the brachial artery. And this is what is seen here in this image. So you see that as it crosses over the brachial artery, the median nerve will then be positioned medially. So you see that there is a change in position of the median nerve from being laterally placed around the proximal region to being medially placed around the distal region. And this is where you see that within the cubital fossa, which is a triangular space or indentation that is highlighted here in black, around the anterior region of the elbow, you see that the median nerve is positioned medially to the brachial artery. And this, of course, is as a result of the pattern in the change of movement. So within the cubital fossa, we see that the brachial artery is crossed by the bicipital aponeurosis. And this is what is highlighted here in hash. You know that the bicipital aponeurosis is a fascial extension from the tendon of the biceps brachii muscle. If you go back to our lecture on the muscles of the arm, if you've not checked up that lecture, please kindly go and do so. In that lecture, we say that the biceps brachii muscle is made up of two heads. It is made up of the short and also the long heads. We say that at the inferior region, the short and the long heads will unite to form a single tendon. This tendon is seen to insert on the radial tuberosity. And this is what is highlighted or harrowed here in dotted red. The radial tuberosity is a rough region that is located around the proximal part of the radius. And this is what creates the insertion site for the common tendon of the biceps brachii. If you then go medially to this point of insertion, you see that there is a fascial extension that is referred to as a bicipital aponeurosis. And this extension is also seen to span or cross over the brachial artery. And this is what is seen here around this image. It is important that we also add that the bicipital aponeurosis is also seen to form one of the structural components of the roof of the cubital fossa. So it is important that we also highlight that within the cubital fossa, that the bicipital aponeurosis is seen to be related anteriorly to the brachial artery. And this is because it crosses over it within this space. So now let's drive further where we'll be describing the different branches of the brachial artery. So this is where we have the brachial artery that is harrowed in black. So the first branch here is the deep brachial artery. This deep brachial artery is what is harrowed there at this point. is also referred to as the profunda brachial artery in old text. Profunda brachial artery is a posterior emergence of the brachial artery. Then the second branch is the superior ulnar collateral artery, and this is what is heralded in gray. This artery is an emergence from the medial side of the brachial artery. Well, if you go more inferiorly, still on the medial side, we have the inferior ulnar collateral artery, and this is what is also heralded in blue. Then we have the muscular branches, which of course we have a number of branches also emerging from the brachial artery to give supply to the muscles around this region. Then we have the nutrient artery of the humerus. This nutrient artery of the humerus is mostly seen as an emergence of the profunda or the deep brachial artery, but may sometimes be seen to emerge directly from the brachial artery. Then the last emergence had the two terminal branches, which are the radial and the ulnar arteries. These two arteries is what the brachial artery will finally terminate and divide into. So we have the radial artery. We say this radial artery is positioned laterally, while the ulnar artery is positioned medially. And we've tried to justify why this is so. So these are the different branches that will emerge from the brachial artery. And we'll be driving into each of these branches. We'll be highlighting their specific details. So the first one we'll be looking at is the profunda brachial artery, which is also referred to as the deep brachial artery. It is the first and the largest branch of the brachial artery, and it is seen as a posterior emergence. If you use this image by the side, this is where we have the profunda or the deep brachial artery. And you see that this artery is, of course, a posterior emergence. So this artery, as it emerges, it is seen to run through the triangular interval. Don't forget that we described the triangular interval in a previous lecture on the triceps brachii muscle. If not check up that lecture, please kindly go and do so. In that lecture, we highlighted that the long head of the triceps brachii muscle is seen to form a number of spaces with the surrounding muscles, and we try to highlight the details behind this. So now let's try and highlight or describe where the triangular interval is located. Using this image by the side, this is where we have the triangular interval here, carved out in yellow. This is a triangular space that is formed by the long head of the triceps brachii and the surrounding muscle. So the long head of the triceps brachii is seen to be forming the medial border of the triangular interval, while superiorly above, we have the teres major muscle forming the border of the superior limit of the triangular interval. While if you go more laterally, you have the lateral head of the triceps brachii, and this is what is heralded at this lateral region. Because it is a triangular space, it is seen to have three borders. This space, we say, it is not created for fun or for fancy, but it is created to allow for the passage of some structures. So as soon as we have the emergence of the profunda brachial artery or the deep brachial artery, it is seen to pass through the triangular interval. And this is what is highlighted here in red. It is not seen to be passing through this triangular interval alone. It is seen to be accompanied by the radial nerve. And these are the two structures that will be passing through this space that is created. So after passing through the triangular interval, it will then assume the posterior region of the arm. So this interval is what creates the allowance for the profunda or the deep brachial artery to be able to access the posterior region of the arm. So as soon as it passes through this region, it is then seen to run through the radial groove. If you use this image by the side, this is where we have the radial groove here, highlighted in black. This radial groove, we say that it is a spiral groove that is located around the posterior region of the humerus. We've also described this in details in our previous lecture on the humerus. The profunda or the deep brachial artery is not also seen to pass through this radial groove alone. It is also seen to be accompanied by the radial nerve. Don't forget that the radial nerve also accompanies the deep brachial artery, also within the triangular interval. So they follow suit. These two structures, the profunda brachial artery and also the radial nerve, accompanies each other through the triangular interval and also through the spiral groove. But before passing through this spiral groove, it is seen to give off a number of muscular branches. It is also seen to give off the nutrient branch. So for the muscular branches, it is seen to give off a deltoid branch, and this is what is highlighted here at this point. You see that this deltoid branch here is directed upward or ascending upward, where it will be giving supply to the deltoid muscle that is located above the space. Then it's also seen to give off branches to the triceps brachii muscle. Don't forget that this artery is already positioned around the posterior region of the arm, and in the posterior region of the arm is where we have the triceps brachii muscle. So it is also seen to give up branches to also provide supply for the triceps brachii muscle. While it is also seen to also give up a nutrient branch that is highlighted here in yellow. This nutrient branch is mostly seen as an emergence from the profunda or the deep brachial artery, but may sometimes be seen as a direct emergence from the brachial artery. This nutrient branch will be seen to emerge around the mid-shaft region, where it will be directed towards the nutrient foramen of the humerus. And this is why it provides supply for the humerus itself. So after giving up these branches, it is then seen to be directed through the radial groove. This radial groove, we already said that it is a spiral groove, and within this groove, we also have the radial nerve. So after this point, it is finally seen to terminate into the radial collateral artery that is directed anteriorly, and also the middle collateral artery that is seen to remain in the posterior region. So these are the two terminal branches that it would give. These two terminal branches are referred to as collateral arteries. So in trying to understand how these names are drafted, the radial collateral artery and the middle collateral artery basically are collateral because they will be giving off branches that will be forming anastomosis with the arteries that are located below it. So you see that they are directed downwards, and the aim here is to create collateral or alternative network or anastomosis with the vessels that are located inferior to them. And this is why they are so referred to as collateral artery. So these two branches are the terminal branches of the deep brachial artery. While the radial collateral artery is directed anteriorly, the middle collateral artery remains in the posterior region. So for the radial collateral artery, it is radial because what it will be creating collateral or anastomotic network with is branches from the radial artery. So this is why it is referred to as the radial collateral artery. So let's see how this will be unfolded. So this is where we say that we have the brachial artery. We already highlighted that this brachial artery will finally be terminating into the radial artery on the lateral side. Don't forget that this is the lateral side, and also the ulnar artery on the medial side. Don't also forget that this is the medial side. So from the radial artery, we have an emergence that is referred to as the radial recurrent branch. This radial recurrent branch is what will be directed upward to meet with the radial collateral artery that is directed downwards. And at a point here, they are seen to create anastomosis. So you can see how these names are drafted. For the radial recurrent artery that will emerge from the radial artery, it is recurrent because it is directed upward, and it is going upward in the quest of creating anastomosis with the radial collateral artery, which of course is one of the terminal branches of the profunda or the deep brachial artery. So you see how these names are drafted. And don't forget that the radial collateral artery is directed anteriorly, and this is the only part where it will be able to access the radial recurrent artery, which of course is a branch from the radial artery. It is just in a way for it to perfectly create this anastomosis at this anterior region. So for the middle collateral artery that we say remains around the posterior part, there's also a reason why it is saying around this region. We say that the middle collateral artery will also be creating anastomosis or collateral network with arteries that are located inferior to it. So let's see how this will also be unfolded. The middle collateral artery will be creating anastomosis with the interosseous recurrent artery. So let's see how the interosseous recurrent artery would emerge. If we go back to the point where the brachial artery bifurcates, we say that laterally we have the radial artery, while medially we have the ulnar artery. From the ulnar artery, we have the common interosseous artery. This common interosseous, from the name, you see that it is directed towards the interosseous membrane. And this is what is harrowed here in red. This interosseous membrane is a membrane that separates the radius from the ulna. And this is what is highlighted here at this point. So this is where we have the radius, and this is where we have the ulna. So you have this interosseous membrane spanning through the radius and also the ulna. And you see the common interosseous artery finally also bifurcating into the anterior interosseous artery, which of course is seen to pass through the anterior part of the interosseous membrane, and also the posterior interosseous artery, which of course is seen to be directed posteriorly. And you see that the posterior interosseous artery is directed posteriorly. So it is now within the posterior region. So it is from the posterior interosseous artery that we have the emergence of the interosseous recurrent artery. And this is what is carried at this posterior region. So this interosseous recurrent artery will then be directed upward. And this is why it is finally seen to create anastomosis with the middle collateral artery. Don't forget that the middle collateral artery is one of the terminal branches of the profunda or the deep brachial artery. But we say that this artery is still seen to be placed within the posterior region. While the radial collateral artery is directed anteriorly in the quest of creating anastomosis with the radial recurrent artery in the anterior part, the middle collateral artery is still seen to be remaining in its posterior region. And this is because it is waiting for the interosseous recurrent artery, which of course will be emerging from the posterior interosseous artery, for it to create anastomosis with it around the posterior region. So you can see that this artery will remain where they are positioned, or would rather leave their position, all in the quest to perfectly create anastomosis with the vessels that they are destined to. So it is important that we understand this, that for artery to remain in their position, we also have a reason behind it. And for it to move away from that position, there will also be a reason behind that. I hope that this is understandable as we've been able to illustrate this in details. So now let's move to the superior ulnar collateral artery. Don't forget that in our previous slide, we described the profunda or the deep brachial artery, which of course is the first and the largest emergence from the brachial artery. We also say that this profunda brachial artery is a posterior emergence. We also try to highlight in details the path that it runs and also its branches. So now let's move to the superior ulnar collateral artery. We said that this superior ulnar collateral artery is a medial emergence, and this is what is already in green. So it is seen to emerge medially, and it is seen to emerge around the mid-shaft region. After this emergence, it is then seen to pierce through the medial intermuscular septum. The medial intermuscular septum is a septum that separates the muscles in the anterior compartment of the arm from the muscles in the posterior compartment of the arm. And this is located around the medial region. So it will need to pierce through this medial intermuscular septum for it to be able to access the posterior region. And this is why it is seen to be providing supply for the medial head of the triceps brachii muscle. Don't forget that the triceps brachii muscle is located around the posterior region. And since the superior ulnar collateral artery is now able to gain access into the posterior region by piercing through the medial intermuscular septum, it will be able to give off a branch to supply the medial head of the triceps brachii. So this is where we have the emergence of this branch that will be providing supply for the medial head of the triceps brachii. This artery is then seen to descend further inferiorly. If you go back to how the name is drafted, the superior ulnar collateral artery, we said collateral basically will be creating collateral or alternative anastomosis with the vessels that are located inferior to them. And it is ulnar because it will be creating this anastomosis with branches from the ulnar artery. And it is superior because, of course, it is superiorly placed. So it is important that we understand how these names are drafted. This will make it not only interesting, but also give us a detailed understanding. Let's try and put this image in its correct anatomical position. This is where we have the medial side, and this is where we have the lateral side. So if you look at how this superior ulnar collateral artery descends downward, and since it's already in the posterior region of the arm, don't forget that the superior ulnar collateral artery already pierces through the medial intermuscular septum. And this is why it is able to gain access into the posterior region. So you see that it's directed inferiorly and also passing or patting behind the medial epicondyle. So this is where we have the medial epicondyle, and on this lateral side, we have the lateral epicondyle. The superior ulnar collateral artery is seen to pat behind the medial epicondyle. Don't forget that the superior ulnar collateral artery is already in the posterior region. We already also established this previously. So you see it directed behind the medial epicondyle, and it's directed, of course, inferiorly. And this inferior part is for it to be able to connect with the artery that it will be creating anastomosis with. And don't forget that this artery will be a branch from the ulnar artery. So going back to the bifurcation of the brachial artery, don't forget that this is where we have the ulnar artery, which of course is the medial terminal branch of the brachial artery. So after this emergence of this artery, we have the anterior ulnar recurrent artery. It is recurrent because it is directed upward. Don't forget that we say that the recurrent arteries are seen to be directed upward, and this is why they are needed to create anastomosis with the vessels that are located above them. So we have the posterior ulnar recurrent artery at the posterior region. It is this posterior ulnar recurrent artery that, of course, will be creating anastomosis behind the medial epicondyle with the superior ulnar collateral artery. So you can see how interesting this is. For these arteries to be recurrent, it means they are going upward. And for them to be collateral, it means they are going downwards, where they will be connecting with the recurrent artery to create alternative anastomosis. And this is what is projected here. So now let's move to the inferior ulnar collateral artery. But now we should understand how these names are drafted and the basis behind them. This inferior ulnar collateral artery is seen to emerge medially also because it is a medial emergence, just as the superior ulnar collateral artery. The only difference here is that this is inferiorly located. So it is seen to emerge about 5 centimeters proximal to the elbow joint. If you use this image by the side, this is where we have the inferior ulnar collateral artery that is arrowed here in blue. You can see that above this region here is where this arrow is pointing, is where we have the superior ulnar collateral artery. We already described this superior ulnar collateral artery in our previous slide. So inferiorly to it, we have the inferior ulnar collateral artery. We say that these two arteries are medial emergence. So you see this artery as it emerges, is seen to divide into 2 branches. So we have one of the branches, of course, forming a spiral where it will be piercing the medial intermuscular septum. Don't forget that piercing this septum will allow these vessels to be directed posteriorly. And this is why it is seen to run behind the humerus here, where this arrow is pointing, in the quest of creating anastomosis with the middle collateral branch, which of course is one of the terminal branches of the deep brachial artery. If you go back to the deep brachial artery here, where this arrow is pointing, you see that there is a terminal division of the radial collateral artery and also the middle collateral artery. This middle collateral artery will say that it remains in its posterior region, and this is why it is directed downwards, where it will finally be creating anastomosis with one of the branches of the inferior ulnar collateral artery. This branch is seen to spiral around or run behind the humerus so that it would be able to create collateral or alternative anastomosis with the middle collateral artery. And this is what is harrowed at this point. This same branch is also seen to create anastomosis at this point that is harrowed in green with the superior ulnar collateral artery. So the second branch of the ulnar collateral artery is seen to descend inferiorly, and this is what is harrowed there in yellow. And of course, it is seen to pass through the anterior region of the medial epicondyle, where it will finally be creating anastomosis with the anterior ulnar recurrent artery. Don't forget that this is where we have the medial side, and this is where we have the lateral side. This is where we have the ulnar artery. We say that from the ulnar artery, we have the anterior ulnar recurrent artery, and behind we have the posterior ulnar recurrent artery. So you see that this anterior ulnar recurrent artery is seen to pass along the anterior region of the medial epicondyle, and this is where it will be creating anastomosis here with the second branch of the inferior ulnar collateral artery. This second branch is not seen to pierce through the intermuscular septum. It is seen to maintain the anterior course, all in the quest of creating anastomosis with the anterior ulnar recurrent artery. While the second branch, we say we pierce through the medial intermuscular septum just to gain access into the posterior region. And the aim here is for it to create anastomosis with the middle collateral branch of the deep brachial artery. So you can see how these arteries run all in the name of being able to connect perfectly with the branch that they will be creating anastomosis with. So now let's go to the muscular branches. We have a number of muscular branches emerging from the brachial artery. This is where we have the brachial artery here, arrowed in blue, and you have a number of branches, highlighted here in gray, providing supply for muscles that are located in the anterior region of the arm. And these include the biceps brachii muscle, the brachialis, and also the coracobrachialis. We go back to our lecture on the muscles of the arm. In that lecture, we described that in the anterior compartment, we have three muscles. We have the biceps brachii muscle that is seen to take up the chunk of that space. We also have the brachialis that is inferiorly located, and we have the coracobrachialis that is superiorly located. These three muscles also receive muscular branches from the brachial artery. So now let's move to the terminal branches. The terminal branches are two. We have the radial artery, and this is what is arrowed at this point, and we have a larger ulnar branch, which is what is also arrowed at this medial side. Don't forget that the radial artery is located laterally, while the ulnar artery is seen around the medial side. Specifically, the brachial artery is seen to finally terminate around the neck of the radius. This is where we have the radius on this lateral side, and this region where the arrow is pointing is where we have the neck of the radius. So let's dive into these two terminal branches. So for the radial artery, it is seen to give off a radial recurrent artery. Around the elbow joint, this is where we see the radial artery. This radial artery is seen to give off a recurrent branch that is referred to as the radial recurrent artery. We say that the recurrent artery will be directed upward, and this is in the quest of creating alternative anastomosis with the branches that are located above them. Don't forget that we have the radial collateral artery here at this point where this arrow is pointing, which of course is one of the terminal branches of the deep brachial artery. It is this radial collateral artery that will descend inferiorly and meet with the radial recurrent artery to create anastomosis with it. Then if you go to the ulnar artery, the ulnar artery is seen to give off three branches. We have the anterior ulnar recurrent artery. This is the anterior ulnar recurrent artery, while behind it we have the posterior ulnar recurrent artery. And this is what is arrowed there in ash. We also have the common interosseous artery, and this is what is arrowed there in green. So for the anterior ulnar recurrent artery, you see that it will be creating anastomosis with the inferior ulnar collateral artery. And this will be seen in the anterior part of the medial epicondyl. We already also highlighted this in details in our previous slide where we described the inferior ulnar collateral artery. While the posterior ulnar recurrent artery is also directed upward, but behind the posterior region of the medial epicondyle. And this is where it will be creating anastomosis with the superior ulnar collateral artery. So you see that the anterior and the posterior ulnar recurrent arteries are seen to be directed anteriorly and also posteriorly to the medial epicondyle. And this is the part that they can run individually for them to assess the arteries that they will be creating anastomosis with. Then for the common interosseous artery, you see that it is directed towards the interosseous membrane. We already also described this in our previous slide. So from the common interosseous, we have the anterior interosseous, and this is what is arrowed there in black, and behind it we have the posterior interosseous. It is from the posterior interosseous that we have the recurrent interosseous artery, and this is what is also arrowed there in black. This recurrent, we say is recurrent because it's directed upward, but it is an emergence of the posterior interosseous artery, and this is why it is saying to be directed upward, where to be creating an anastomosis here with the middle collateral artery. Don't forget that the middle collateral artery is already positioned around the posterior region. So this is where these anastomosis are created. So now let's move to clinical anatomy, and we would be looking at the brachial pulse. Brachial pulse is as a result of the superficial placement of the brachial artery within the cubital fossa. Don't forget we already highlighted how this artery is positioned, and this can be used for blood pressure measurement. If you look at this image by the side, this is where we have the cubital fossa, And within the cubital fossa, we have the tendon of the biceps brachii muscle that is highlighted here in red on this lateral side. And this is where it is finally inserted on the radial tuberosity. So this is where we have the brachial artery that is highlighted here on the medial side. And at this point, it is being used for blood pressure measurement because of its pattern of placement. So thanks for watching this video. Let's continue to stay glued to the channel.